So you're very welcome to the University of Warwick MSc in Diabetes Care. Thank you for taking time out of your very busy schedule to be with us for today. We'll try and keep the full webinar to within 1 hour because we understand you're very busy clinicians with also family commitments and loads of things to juggle. So we'll try and keep it to 1 hour maximum. So the running order for today is, first of all, Diarmuid is head of our academic affairs, and he's going to interview one of our existing students, Shafak, from Qatar, who's currently in module 3, just to see how she's getting on and give an overview of the real experience of what it's like from a student's and participants' experience to be on the programme. Next, I'll hand you over to Dr. Colin Kenny. Dr. Kenny is actually, hi Colin,
Good morning.
Good morning. He is the program lead, the program director of the Masters, and he will talk you through essentially the state of the nation of diabetes care globally and where we are in terms of interventions and give you an overview of the program. I'll just finish up with the program structure, then the pricing, the curriculum, and general need to know facts and entry requirements, etc. And then we'll open to Q&A straight afterwards. So without further ado, I will hand you over to Diarmuid to talk to Shafak.
Brilliant. Thanks a million, Rebecca. Shafak, great to see you again. I suppose, do you want to just start by just briefly introducing yourself and kind of what your role is, and why did you choose to do a postgraduate qualification in diabetes?
Yeah, sure. Thanks, Dermot. Good morning, everyone. I'm currently working as a family care physician in Doha with Primary Healthcare Corporation in Qatar. I've been in Doha for about 3 years now, and the vast majority of our work is diabetes care. And I think as I went through my clinical day-to-day activities, I realized that I had gaps in my knowledge, and this was something that I was struggling to fill whilst attending conferences and things like that. And Warwick has an excellent reputation for diabetes care. I spoke to a lot of colleagues who had previously been on the course, and they highly recommended the course to me. And hence, once the COVID pandemic hit, I thought it was the best possible time to utilize, the extra time I had to do something that I've always wanted to do, but kept putting it off for one reason or another. And I'm currently in module 3, so I'm nearly halfway through the course and thoroughly enjoying it so far.
Brilliant. And Shafak, I mean, you touched on it there. You started a course during COVID-19 when most healthcare professionals got really, really busy, and busier than they usually would be. How have you found juggling your work commitments, the study commitment, managing that with family? How have you found kind of being a full-time clinician and a part-time learner?
The initial fear, I suppose the fear of the unknown, how I was going to manage, was there. But I think that settles down quite quickly. I think after the first couple of weeks, you settle into a pattern for yourself. I think planning was key.
Yeah.
Realizing what time I had around my work and family commitments. And really, once you plan for the week ahead, I think you can't go wrong. I think it's the reading and academic commitments are not too bad. You can structure your day. And I found that actually in the middle of a pandemic, when you are busy, it's almost refreshing to do something different, because pandemic fatigue can set in quite quickly. And really, I've enjoyed doing something different apart from thinking about COVID-19. And I've used my time indoors in a very productive way, and I'm really glad I chose this time, actually.
And how have you found? I mean, one of the things that I used to think of when I think of kind of an online or distance course is that it's almost like a solo run. How have you found? There's 80 odd people on this call, and there's a couple of hundred people on the course worldwide, but everyone's in their own group of 20 odd people. How have you found getting to know your group and your tutors? What's that dynamic been like?
Our group has about roughly, I think, 10, 12 healthcare professionals. It's quite an intimate group, and we meet on a weekly basis. It's quite refreshing, actually, because everybody is from different parts of the world, practicing in different ways, their experiences, and it's quite a rich learning environment. So initially, it can feel quite daunting, But once you settle down into your individual tutor groups, it's quite nice because you get to know people on a first name basis. You get to know the tutors get to know you. So it's nothing to be worried about initially, because it's quite enriching to be part of such a small unit, and you're meeting on a weekly basis and discussing cases. So it's very beneficial.
Yeah, I think those touch points that you speak of, Rebecca will touch on this later, as will Colin. I think they're really important so that people don't feel that they're, you know, alone on this journey. The last thing that I was going to ask you is, when it comes to, you know, a lot of people that are considering a program, they love the idea of diabetes. They might not love the idea of the essays or that side of it. How have you found the assessment end of it?
I think a lot of people like myself, I mean, we're coming into academic writing and academic work after a long hiatus of clinical practice. So, you know, but I think you're guided so clearly through the entire program, and the tutors are excellent. They support you throughout. I mean, I've had times where I've emailed, you know, my tutor to say, I'm struggling with this, could you help? And the support is excellent. So I think the initial fear, you settle down, you find your own style of writing, you find your own style of critiquing evidence, and it comes back to you naturally. But it's all there.
And I suppose the last most important question: are you finding now, and you're almost 6 months in, so you're at the halfway point of the postgraduate diploma part, is it having any impact on how you're managing patient care?
I have to say, my mindset has shifted, Dermot. Whereas initially, when we are faced with a complicated patient, you know, that worry, that knowing that there is a gap and how to fill that gap adequately. Whereas now, my mindset has completely shifted. I've done a 180, where I'm actually looking for those patients, because I find it so rewarding to find them and so-called manage them better. So, you know, it's given me the confidence that actually I can do this. I'm much better in my consulting skills. You know, the psychology module that we're doing at the moment has really refined my communication skills to no end. So I think from worrying about those patients when they come into your room to actually welcoming them and saying, come, I want to talk to you about your diabetes, it's a huge shift. And it only comes, I think, with time and confidence. And the course has given me that. So I'm incredibly grateful.
That is fantastic, Shaka. Thank you so much. I'm conscious of time, Rebecca. So I mean, we'll take questions as we go along through the chat function. But Shaka, thank you so much for your contribution this morning.
Pleasure.
It's great to see you again.
Thank you.
Thank you so much, Shafak. You're
you.
brilliant. We really appreciate it.
Thank you.
Just there's a few people having sound issues. I know you can't hear me if you're still having sound issues, but hopefully they're resolved, because I just left a detailed message on how to resolve it. So hopefully you can hear us now. So now I will now hand you over to Dr. Colin Kenny, who's our program leader.
Yes, good morning, everyone. I know it's not morning in the Middle East, but it's morning for me. And I'm going to give you a little presentation this morning on aspects of the course. Now, hopefully you can see that screen this morning. And, you know, if you take this course, as Shafiq has told us, you go on a journey. There's no doubt about that. And I'm going to take on a little journey this morning. I'm going to look at what the course is involved. I'm going to look at the world of diabetes. Then I'm going to look at key course content and then an update on management. Let's start with the flavor of the course. Well, the course is comprehensive. We do follow the IDF curriculum, and we talk a lot about the IDF. Yes, we talk about type 1 diabetes, but mostly the course covers type 2. As you've heard already from Shafiq, we have experienced tutors who are both practical as well as academic. The content does focus what's important in your region. We look at modern management, particularly individualizing care, and important updates on studies and guidance. It is an online format. You do meet every week, but it is flexible. It tends to fit around your work. You can participate from your office or place of your choice. We do have weekly tutorials, as Shafiq has said, and they're recorded, so you can pick them up later, and there's lots of interaction and motivation. So now key course, the world of diabetes. Well, I suppose when you look at the world of diabetes at the minute, there's diabetes and its driver, the largest epidemic in human history. And I've been using that particular slide for a while, but as you know, this year, nobody needs to be reminded that the COVID and diabetes have interacted to become two very big pandemics that are very relevant to us. Just to say then about the diabetes epidemic, there is a 54% increase in diabetes from 2010 to 2030. Many of you in the Middle East are seeing extremely high prevalence of diabetes. The Middle East is a particularly active area for diabetes. Just to give you an insight into that, Shafiq has told us that a lot of her cares is people living with diabetes. And as you can see, that's 20% in Qatar, 20% in Kuwait, Bahrain, Saudi, and the UAE. And the reasons for this are lifestyle issues in the Middle East, calorie-laden food with high rates of obesity. The management of diabetes needs to take a culturally sensitive approach, but then national budgets cannot afford the bill demanded by healthcare sectors to treat diabetes and its complication. And then finally, most governments in the Middle East are looking at prevention being better than cure. There is a lot of global inactivity. Kuwait is quite close to Qatar, and you can see there 67% of the population are completely inactive. Now, I'm not saying that we're any better in the UK. There's a lot of physical inactivity in the UK, but physical inactivity is increasingly being looked at as a risk factor for diabetes as well. So I've given you a course overview and I looked at the world of diabetes. I'm coming on to key course content. There's a lot of sand in the Middle East. Last night I was teaching my students about this line in the sand where you can diagnose diabetes, and the diagnostic criteria is 48 millimoles or 6.5%. Of course, we go into much more detail on this in Module 1. In Module 2, we look at the treatment of diabetes. We tend to follow the ADA guidance in this. This guidance updates every year. That's the 2020 guidance. It'll update next year as you do the course. Of course, we talk about oral medication. You're all very familiar with the oral medication. There's metformin as the starter, and then there's DPP4s, SGLT2s, pioglitazone, and sulfonylureas. And then, of course, we move on to insulin injectables. Insulin is controversial. A lot of people feel it's the last resort, but I know, speaking to students in the Middle East, a lot of you are comfortable with using insulin. As you'd expect in a course like this, we tell you where all these agents work. And I'm not going to, this is a detailed slide, but as part of module 2 on the course, we go into quite a lot of detail, where they work, and then how they work. Targets are controversial because quite a lot of organizations have different targets, but what we like to say is the targets are based on individual patient characteristics, preferences, potential side effects, and cost, which is what NICE and SIGN tell us. And as I suppose we help people set targets, we start at the problem, develop a collaborative goal, and then validate their goal and plan. The mantra is that there's no decision about me without me. We inform patient choice. Now, there's a need for an expert patient because people living with diabetes spend 3 hours a year with a healthcare professional on average, and for the remaining 8,757 hours, they have to manage this complicated condition themselves, which is why we try very hard to empower our patients. Language matters, folks. The way you speak to people is very important. If I'd been talking to you 15 years ago, I'd have talked about diabetics, but actually we much prefer that you refer to them as people living with diabetes. The language you use and non-judgmental, stigma-free language is also very important. As part of the course, we talk about emergencies. Everybody knows how to differentiate between hyper and hypoglycemia. I would expect you to know that, and we go into that in a great deal of detail. But there are other emergencies. So here's a 67-year-old patient who's have been living with diabetes for 15 years. They come into the nurse at the treatment room. Well, I would say you would be worried about the appearance of that foot, that black spot. You would notice that the foot is heavily calloused. You would see that there's a black area there, and then this red area certainly signifies some infection. So this also is an emergency. This is something that needs a same-day referral to secondary care, as this patient could well have osteomyelitis, an infection, and be very much at risk of losing that foot. Module 4, then, we deal with microvascular complications, as you would expect, retinopathy, kidney failure, and nerve damage. Module 5, we deal with the macrovascular complications of diabetes, heart attacks, strokes, and poor circulation. We emphasize a lot about accurately gathering albuminuria, because albuminuria is a very important indicator of cardiovascular risk. And remember, you may have an eGFR of 48, which is fine. You would be at moderate risk. But if you have a degree of albuminuria, you suddenly go to a high-risk individual. So that's an overview of the course content. Just to give you a little bit of a view about breaking trials and updates. None of you need to be reminded about COVID, but this was the Lancet a couple of weeks ago, just reminding us about poor metabolic outcomes with and COVID. COVID is much more likely to give you ketoacidosis and hyperglycemia if you're living with diabetes. There's a very significant mortality risk, which I'll come back to. And now we've discovered that the SARS virus can help to precipitate type 1 in vulnerable individuals as well. I think just worth observing, if you're living with type 1, just look at the increased mortality associated with COVID. And then finally, this paper published this week in DOM, it's diabetes and hypertension, and especially cardiovascular, are important risk factors for the severity and mortality in COVID-19 infections in people living with diabetes. And they need to be intensively addressed in the management of this infection. Again, some breaking evidence, 2 very interesting trials in the last month. The DAPA-HF and Emperor Reduced trials are giving us a sign that not only are SGLT2s helpful for people living with diabetes, they can also be useful for heart failure. Another interesting and important trial is the DIRECT study. For the first time, we've seen that people living with type 2 diabetes who achieve a significant weight loss greater than 10 kilograms can put their diabetes into remission. And this is really very exciting. It's led to the Daily Mail in the UK telling us that soup and shake diet can be available on the NHS and can reverse diabetes. I've been doing diabetes long enough to see a lot of these changes that have come about in the last essentially 25 years. Several statements have come along. They've been driven by these series of trials, the cardiovascular outcome trials. I'm not expecting you to know these trials, except that they've all published fairly recently. Of course, in module 2, we go into a great more detail on them, but it's worth just saying that a lot of them have proved very positive. This forest plot shows this area here. You can see quite a lot of the trials were very important for cardiovascular disease. And in turn, this has led to the publications of guidance. So that this of guidance that we got a 2018 guidance and more recently a 2019 guidance. And to summarize this guidance then, if you have somebody living with diabetes who has heart failure, then the drug of choice is of course metformin, but you might want to add an SGLT2 to it. If you've got somebody who predominantly have atherosclerotic cardiovascular disease, then metformin and a GLP-1 is the drug of choice. And it's led to this algorithm. You can see that it's a complicated algorithm now, but starting with metformin, following on then, each drug has its own purpose, depending on whether you've got cardiac disease, whether you want to minimize hypoglycemia, whether you want to promote weight loss, or whether cost is a big issue, as I know it is for some of the expatriate population in the Middle East. So there we are. I've gone on a little journey now. I've given you a course overview. I've given you a bit of a view on the world of diabetes, particularly on the focus of the Middle East. I've shown you what the key course content would be, and then I've given you a very quick update on the management of diabetes. Believe me, we go into a great deal more detail on the course. So why would you consider doing the University of Warwick Diploma? Well, first of all, you're living in a part of the world where there's a high prevalence of diabetes, and that diabetes care is changing. I think if you're delivering, as Shafiq has told us, if you're delivering diabetes care, you do have a duty to keep yourself up to date. So therefore, at the University of Warwick, we offer a comprehensive, convenient way to update your knowledge and skills. Our materials have just all been updated. They're relevant. We work to deliver your knowledge and skills, and you support you with technology, learning, and motivation. Folks, sitting's the new smoking. I don't expect you to get up and walk about, but what I will say to you just now, thanks for your attention. And Rebecca, I know you're going to give us I did a bit of an overview of the course. You're going to go into much more detail for us. Thanks, Rebecca.
Thank you so much, Colin. Just let everyone know you're so welcome to put in your chat and your questions as I'm giving my presentation. So you don't have to wait to the end if you don't want to, because we have over 100 participants on this webinar right now. So just in case we have too many questions to deal with them all at the end of in the Q&A session, it's no problem if you want to just pop your questions in as we progress. But I will be covering price and flexible payment options and the curriculum, and also your entry requirements. So they will be covered during the presentation, just to let you know. One other little piece of housekeeping. If you have an unidentifiable name on your Zoom, like iPhone or Galaxy or something like that, would you mind just sending a private chat to us, letting us know your real name? I don't think there's many, but if there are a few, and then we can make sure that you're checked in and you get the correct communications after the event. So I am just going to share my screen now with you. Now, can everybody see that?
Yeah, that's perfect.
Yeah, great. Okay, everyone. So when you hear about the University of Warwick MSc in Diabetes Care, you're going to hear about IHeat in the same sentence and in the same breath, and see the two logos intermittently and together. So who are IHeat and how we relate it to the University of Warwick? We're actually an online program management company. We're an Irish organisation. So we build and design and develop online education for globally across the globe for world-leading universities, medical universities and postgraduate training bodies. We have wonderful relationships with and high-level MOUs with healthcare ministries and governments around the globe, particularly in the Middle East. So we have a long working relationship with HMC and PHCC, particularly HMC in Qatar, with Saudi Commission, with SEHA, with DHA and Emirates Medical Association, with OMSB, with KIMS. So almost every single country in the Middle East, we have a wonderful high-level relationship with the Ministry of Health and governing bodies in the healthcare sector. We are medical education specialists. A lot of online education organizations, they do online education in business and engineering and computing and also medical. We only specialize in medical education for a very clear reason, that our CEO is a GP, family physician who founded the organisation 7 years ago. And we have a huge amount of key opinion leaders and medics on our staff. And we're delighted to have that. So we're led by medics who understand the challenges that you're under. We have 300,000 course completions on our learning environment and over 30,000 clinicians registered globally. So you may not have heard of us, but we actually do have a very large global footprint, particularly in the Middle East. So a little bit more about the University of Warwick. If you're not familiar with it, Shafak said that she had done her own research in advance and that she was reassured by knowing that the University of Warwick has an excellent reputation in diabetes education, which is true. It's a top 10 United Kingdom university ranking in the QS rankings and 62nd in the world in the QS rankings in the World University rankings. They have educated over 14,000 clinicians in the United Kingdom and upskilled them in diabetes. So they really are very renowned locally in the United Kingdom for their contribution to upskilling of diabetes educators and diabetes clinicians. They're a member of the Russell Group, which is really the equivalent of the Ivy League in the United States for the United Kingdom. So it's the top research-centric universities in the United Kingdom. So they're a member of that group. And they're world leaders in diabetes education. And most importantly, on the university certificate that you receive, it never states that it is online or distance or blended learning. You get the exact same university certificate as if you flew to the United Kingdom to the University of Warwick and studied for 1 or 2 years doing your master's program. So there's no differential there whatsoever. So that's important to know. Colin has covered this in detail already, so I won't spend much time on it, but 1 in 3 of the deaths of COVID-19 around the planet have had diabetes as one of their comorbidities, and it is independently assessed as a high risk factor. So I was talking to a diabetes nurse in Ireland about this recently, and it was really frightening because people living with diabetes are of a high risk, and they know that, they've heard that in the media. They really are self-isolating, and they're isolating in their homes, and they're not going to see their clinician. They're not getting the same level of support as they usually would. Their glycemic control is not under control. She said, unfortunately, that because they're experiencing isolation and mental health challenges because of COVID, they are actually comfort eating an awful lot of her patients when she reaches out to them by phone or by video conference. And she really is very, very worried about the long-term impact of the interrupted care on her patients living with diabetes. So this particular graph is from Médecins Sans Frontières, and it just graphs or maps a former pandemic globally. And the third wave is always about interrupted care on chronic conditions. And of course, patients living with diabetes are in that category. So there's never been a more important time to focus on them and focus on the upskilling, particularly with this NCD. In addition to that, as Shafak said, when the pandemic first started and really globally exploded back in February, March, we had our intake for that season around then, and we had discussions with loads of doctors on the phone, and they were saying, oh my goodness, I just can't study online right now. With the pandemic, I'm under so much pressure, I'm under so much stress. And those who decided to go ahead with the program, we actually had the highest level of attendance that we've ever had. And I think it's because people can't go to the gym, you can't go out, you go to your clinics, you do your work, and we're so isolated and confined that actually, unusually, it is the ideal time to study and to upskill. So we found now for this intake that we have the highest enrolment ever for the United Kingdom and Ireland. And once again, our attendance levels at the tutorials are exceptionally high. So ironically, this is the ideal time to upskill during the pandemic. But I will just add to that we understand that you are all under an awful lot of pressure in your clinics and in your working environment. And we have an exceptional team in the academic affairs team and mentors to make sure that you are okay, and extenuating circumstances if you are experiencing any challenges on the programme. So now to just go into more detail about the programme itself, it is based on the IDF, the International Diabetes Federation recommended curriculum. So it is absolutely international best practice. And just to let you know, we actually originally designed this programme for the Middle East. So we're very sensitive, and the programme is highly nuanced to your area. Even the graphics, our cases, everything is bespoke to your area. So it's not as if it was a United Kingdom qualification and we have cut and paste the same qualification across the globe. This has been developed specifically with the Gulf in mind and with the GCC. So we're very proud of that. And I think all of the participants on the programme really appreciate that we understand the local challenges. So the postgraduate diploma is what you start with and must start with, and it is a 12-month part-time postgraduate diploma. So that's a full 12 months from beginning to end. And if you are still eager and keen and want to progress, we have an additional MSc in Diabetes Care straight after, which is additional, I say 20 months there, but really it's an additional 10 months after the postgraduate diploma. So the two of them together will take you around 22 months in total to do the MSc. So 12 months for the PG dip and 22 months for the MSc if you want to progress. And as I said, it's designed around the IDF curriculum. So it's best practice in terms of what you need to see in a curriculum. It's developed specifically for the GCC. It's full international accreditation from the University of Warwick. We have local accreditation and recognition across the Gulf, including support from the Emirates Medical Association, Emirates Family Medical Society, the DHA, SEHA, HAD, QCHP in Qatar, and we're in the process of getting CME recognition from Saudi Commission as we speak. So we really do put an awful lot of effort to make sure that the programme is recognised in your area. Designed and delivered by world-leading diabetes experts. That's one of the beauties of the fact that this is delivered by IHeat in partnership with the University of Warwick. We don't just hire Warwick staff, professors. Of course, we have their professors on the programme, but we can also cherry pick from the world-leading diabetes experts across the globe, and that's exactly what we've done to make sure that you are getting the best calibre education. And it's delivered on the world's most advanced medical education platform. I have been in university education and tertiary education for 20 years, and I have seen online distance learning at its very best and its very worst. And I've seen many distance education, the reason why they get a bad name, and some distance education programs, because they're so unengaging. They throw these terrible PDFs at you to read yourself, and there's like talking head videos, and it's just really not possible to stay motivated or engaged in a program like that. This program is the exact opposite. It's so engaging and interactive. We spent over €500,000 on the development of this program originally. So in terms of, it has hot topics, it has 3D videos, it has a huge amount of interaction, it has links to a massive library and formularies, and your reading list is linked into that library. And just in terms of the touch points, and that's the most important thing, and Shafak talked about that earlier, that we have with the students, so you feel part of a collegiate environment rather than totally isolated. So we have the face-to-face tutorial once a week for an hour with the rest of your class. You get to know your tutors and the rest of your classmates and participants extremely well. You're definitely not a number, you are a name, and we get to know you very well. At the top of that, and I'll talk about it a little later, we have the forum, we have your mentors, we have the ability, because it's an online forum, that we have analytics that we can tell if a particular individual is just not engaging, they don't have a number of page views, they're not attending the tutorials, they're not engaging with the forums, then they will be flagged on our system as high risk, and we will reach out to you and just ask if there's anything we can do to help. And if there's anything that you need, if you need some time out, anything like that, to make sure that you feel helped and you feel that you're not alone and you're not isolated, and we can help you through the program even if you're having your own personal challenges or overloaded at work. So The faculty and tutor network, this is just a sample. There are obviously a lot more. Another thing that we find extremely important is to amalgamate international expertise with local expertise, because it's very, very important, as I said, in terms of getting the local nuance and the local challenges, even in terms of medications available on public and private health insurance. And what's available locally is imperative. So we combine our international and our UK experts with the best experts in the Gulf. So Dr. Colin Kenny, as I said, is here today, and he's our program director. He's also an RCGP examiner and past chair of the Primary Care Diabetes Society. Dr. Martin Hadley-Brown is University of Cambridge and UK Primary Care Diabetes Society, and he's advisor for the Diabetes UK Clinical Diabetes Lead. And he is also a NICE committee member. Dr. Stephen Lawrence is University of Warwick, a UK Primary Care Diabetes Society, an advisor for Diabetes UK Clinical Diabetes Lead as well with the Royal College. Katie Reid's University of Manchester, and she's Programme Director and Master of Public Health in the University of Manchester previously. And she's an expert on behavioural change in a clinical setting. That will be in Module 3. And Dr. Mohammed Farghali, I'm sure many of you, particularly in the UAE, would know Dr. Farghali. He's very senior in the Diabetes Society in the UAE. He works with the Dubai Health Authority and the UAE National Diabetes Guideline Committee. And Dr. Adil Salim, he's consultant family physician and working in SEHA. So that's just a sample. There are a lot more tutors, which you'll get to know very, very well. So what does the program mean for you on a day-to-day basis? Even though we take in over 300 clinicians on this program from across the globe on an annual basis, you will only be part of a very small group that you will get to know very well. There's 20, maximum 30 participants in your group. And sometimes the doctors and the clinicians set up their own WhatsApp groups, and it's very collegiate. You get to know them very well. There are 6 by 6 week modules in the postgraduate diploma. So you have 6 weeks modules, then you have a 2-week break in between each module. And we're also very sensitive to local holidays, and we do break for national and local holidays in every region that we're in. Personal commitments, and everybody gasps and is when I'm in a face-to-face environment and I say 10 to 15 hours per week, there's a terrible gasp when people go, I can't do that, I can't commit to that. Just being very, very honest. And our students will say the same. Realistically, it's 3 to 4 hours, maybe 5, that they would spend on their learning a week. Of course, it will be more when you're submitting an essay and when it's coming up to the exams, but it won't be 10 to 15. Realistically, you're there for your tutorial, you participate in your forum, and you do some of your reading. The most important thing is to get into a momentum, get into a routine that you're comfortable with and that comfortably fits into your clinical and family commitments, and just set aside that bit of time every week. Maybe it's before the tutorial, and then just get in that nice little routine, that nice little momentum, and then that's the way that the clinicians say it's best to handle it themselves. So don't be put off or scared about those hours. And as I said, there's wonderful support from the mentors in the academic affairs team in IHeat, who you'll get to know extremely well on your tutorials. They're always there if you have technical issues, and they will reach out all of the time to make sure you're okay. In terms of the syllabus itself, in terms of the curriculum, this is the first semester, so the first 3 modules. As Shafak said, and you hear this all the time from students in the program, she said she's now hunting out the complex cases. She's now looking for the individuals that are in trouble or challenged, where maybe she once in her practice, she wouldn't have done that. And that's what we see a lot. And that starts happening even after the first module, where you're looking at epidemiology and diagnosis and screening. If there is in your particular country, if the IDF say there's a 15% prevalence, 15 or 20% prevalence of type 2 diabetes in the adult population, and yet you just have in your clinic 5% of your patients, adult population patients, then there is a mismatch. And maybe we see that our clinicians start, instead of being reactive, they start being proactive. They start taking a deeper and closer look at anybody who's HbA1c above 8 and begin to really work and implement preventative measures rather than reactive measures. So I think that's a really important part of the program. It's beginning to reach out and want to make an impact and want to make a change, a clinical change. So that's the first module. The next module, of course, is treatment. It's one of our heavier modules. It's quite intensive. Once upon a time, there was just metformin and lifestyle change, and that was sufficient and a one size fits all. That's no longer the case with the number of injectables and orals across the planet, and so many comorbidities and life expectancy increasing. Diabetes is such a complex disease now, and it must be individualized. The care must be individualized, the interventions and the medicines must be individualized, and you will cover all of that in module 2. You will also look at the more severe treatments in terms of bariatric surgery, which is quite prevalent in the Middle East in comparison to other parts of the world. We do have in the University of Warwick a bariatric surgeon and head of the UK Obesity Society associated with the programme. And then you move into your third module, which is self-management, behavioural change. Once again, Shafak said that that's one that she's doing right now, and she really is enjoying. And we get an awful lot of feedback from our clinicians saying that this is the module they enjoy the most. And it's the area that they thought very little about. In many parts of the world, there has been the tradition of the doctor knows best, and that dictatorial approach to your patients. And I suppose the world over, it's been seen that with NCDs and with many long-term conditions, it's so much more important to bring your patient with you on that journey and to education and to empower. In the NHS, there is a motto, and Colin said about no decision about me without me. So in this module, you learn all about motivational interviewing and the softer side of patient empowerment and really getting them to take responsibility for their own condition. And as Colin said previously as well, 8,800 hours is in the year that your patient living with diabetes must spend, and you have maybe 3 or 4 hours with them. So that's a long time for them to understand and manage their own condition. And if they are empowered, if they really have taken on responsibility, then their outcomes will be so much more positive. So after the first semester, we head into the complications. These are the next 3 modules in your second semester of the PG DIP, the microvascular and macrovascular complications. We'll go into a lot of depth in retinopathy, your foot examinations, etc., how to conduct a very good foot examination. And as Colin said as well, just to spot in areas like your foot where it needs to be escalated quickly, and to really know the difference of when to get someone treated quickly. Macrovascular, of course, CVD is so important, and all of your complications in macrovascular, it goes without saying, and the medicinal treatment that you've learned in module 2. And finally, the special circumstances, which is the last module, it really binds together all of the knowledge from the last 5 modules and looks at what you've learned and how you apply it in special circumstances. That can be gestational diabetes, a lady who is a patient living with diabetes who is planning a family, and glycemic control when you're pregnant. Ramadan and Hajj is extremely important in terms of religious fasting, can lead to both hypo and hyperglycemia, and they can have very severe results as a result of that. So, and in that situation leading up to Ramadan, it's all about pre-planning with your patients around 6 to 4 weeks, 6 weeks, or 4 weeks minimum pre-Ramadan, if you were to bring in your diabetes patients, and we do a separate webinar on this, just to prepare them for fasting and what needs to be done, and really how they need to perhaps adjust their medications. But we have a very intensive webinar that we give free of charge to our clinicians in the Middle East to help you through that process as well. And special circumstances, we look at mental health, 3 times more likely to have some mental health challenges if you are a patient living with diabetes, particularly during the pandemic. And of course, later life and aging with patients living with diabetes, comorbidities and multimorbidities. So finally, we move on to, after the postgraduate diploma, we have around 40% of our students actually move on to the Master of Science in Diabetes Care. And we're very excited about this one because we don't ask you just to create a thesis, a 20 or 30,000 word thesis that will be read by no one but yourself and your supervisor. And that's it, and it will sit on a shelf. That is not what we want. This Masters reflects the practical output of our program. It reflects the fact that we always look at scenarios, we always look at case-based education, we always look at applied education, and the Masters is no different. So for your output, we will be looking for a 4,000 word research article in the style of the ADA, and you will be brought very minutely through how to create that article, with the expectation that you will be published in either a local or national journal of repute. And we also look for a conference poster presentation. Obviously, in this world that we're living in right now, it's not a face-to-face conference, but there will have to be virtual medical conferences until such time as we're able to go back to our regular medical conferences. But in terms of the pathway of choosing and beginning to prepare for your research article, you'll choose a research idea, you'll review the literature, you look at your online design methodology, develop a research proposal, you gain ethics approval, you'll collect your data, you'll do your quantitative and qualitative analysis in that data, and then you'll write the paper, and you'll be guided all the way through that process. And if you get published, obviously it gives your own credentials and your own CV and biography an excellent lift in terms of you're now a researcher and published academic in the area of diabetes, but also it's wonderful for the university that we're giving back to the research community. It's very circuitous in terms of just, we want you to celebrate your learnings. If you're finding wonderful, positive impact on what you've learned in this program and you're applying it to your clinic, we want you to celebrate that. We want you to shout it from the rooftops and get published and share that information with other clinicians that could benefit from it. So how does it work? We start the program on the 29th of November. It's an online orientation for the first week where we get you totally au fait and comfortable with the learning environment. So that's the first week. It's a full orientation where you get to know the academic affairs team very well. We're very understanding that many of you will be out of education for 10, maybe 20 years. And so we make sure that you know how to do your academic writing and how to do all of your referencing correctly. So that is all covered in the first week, and you get to know your class and your tutors then, and we'll give you an overview of what to expect in each module. Then we go on when the program commences on the following week. This is how the structure is formed. It's a weekly discussion forum where your tutor will send out a discussion topic on the forum, and that will cover your learning outcomes for that week, really. It's usually a scenario, a case-based scenario that you will talk openly among the rest of your class, and it will just be moderated by your tutor. The tutor is not telling you what to do, is asking you what you should do in that forum. And then it culminates in the live tutorial at the end of the week. Just to let you know, the tutorial is nothing like this. We don't just sit there talking at you all the time. It's very interactive and engaging. We're all about peer-to-peer learning. So it's very much how Diarmuid and Shafak were talking earlier amongst themselves in a discursive manner. So you learn as much from your peers as you do from your tutor, and the tutor is there to moderate and to guide. And then you have your continuous assessments. The continuous assessments, you have an end of module essay. It's a 2,000 word essay that you submit in that 2-week period at the end of that module. And then you have your end of the semester exams. They're online proctoring exams as well. So you can do them from the comfort of your home, and you don't have to go to an exam center either. So the whole program is built around understanding how busy you are as a clinician and working our program around you as an individual. So this is just some of the screen grabs of what the program looks like. So that's diabetes and retinopathy, some wonderful 3D videos in there for you to learn. And it just shows there's loads of imagery, there's loads of videos, there's loads of quizzes, there's loads of hot topics, and you really easily move and digest very complex information in a palatable format. As I said a few times now, we're all about scenario-based, applied and case-based learning. So this is an example of one of the cases you'll be looking at. A 66-year-old woman, you'll be looking at her HbA1c, her creatinine, her blood pressure, and then you discuss how best to treat this individual. You have expert videos from key opinion leaders across the world, and this is Dr. Mohammed Farghali, and he's also one of our tutors. And then, as I said, you have the live tutorials once a week. They're not compulsory, but we strongly, strongly advise that you can attend them if you can, because it is a wonderful way to get to know your class. And we have direct evidence that those who engage in the tutorials in the forum do have a much higher, I suppose, pass rate and also grade at the end of the programs. The more you engage, the more you put into it, the more you get out of it. But if you are very busy, you're on shift work and you can't make the tutorial, they are recorded. So don't worry, if you miss it, you can catch up and you can watch it in your own time. So I have touched on this already. You have very, very strong support. You will not be isolated. You will not feel alone. Your program leader, Dr. Colin Kenny, your tutors, your mentors in the academic affairs team, your course management team, technical support, they're the least used of all of our team because the system just works. It just works. It works exceptionally well across all devices, particularly on your laptop and your tablets. And you have a lot of local support in the Gulf as well. We have our office in Dubai. And so our director of international and our director in the Middle East is based in Dubai. And so if you need to talk to someone locally, he can pick up the phone and talk to Anthony also. And student support, we have actually, it's 36 different countries, 300 plus students from 36 different countries, 88% student engagement on the platform. That's a huge level of engagement for an online program, but that just shows just how palatable and I suppose easy the program is to navigate and to engage with. We've 100%, we give out questionnaires to our participants at the end of each semester and at the end of the program. And there's 100% positivity on program support and organisation. And there's a 92% pass rate, and that's not because we mark easy. It's because genuinely the clinicians are professional, mature individuals who understand how important it is to study hard, and it's a testament to your hard work, not our easy marking. So the program impact, this is a graph of before and after in terms of the confidence levels after the postgraduate diploma of the clinicians who've done the program. So the purple is before and the green is after. So the clinicians go from anywhere between 40 and 60% up to 100% after they complete the program in anything from prescribing for CVD prevention in type 2, initiating GLP-1 agonists, recognizing emotional distress in a young adult with type 1. So you can see the confidence levels are hugely improved. And this is a survey we did 3 years out with our alumni who graduated 3 years ago. And you can see in terms of they have graded the large positive impact of the program on patient care and quality or clinical outcomes has been hugely improved, nearly up to 80% almost. And in their career, a positive impact on their career. What I will say about the career, our academics, our students and alumni in the Gulf, we're so proud of them. And many of them have opened up their own diabetes clinics. Some of them are leading in diabetes committees at a strategic level and a national level. They're on a national diabetes committees and actually steering the national approach to diabetes management in their country. And we have some students who have gone on to tutor and be academics in a university setting. So the program really has had some wonderful effect on your career. Just to be very clear, it does not make you an endocrinologist. It does not make you a diabetologist. No online program that you can do in 1 or 2 years, if you go to the master's, will give you a diabetologist status or specialist status. It is there to enhance your clinical capabilities and to upskill you in diabetes management in your community and in your clinics. Reputation with your colleagues is enhanced. And one of the ones that the participant found hugely relevant was understanding clinical trials and new research. And that's nearly 90% improvement before and after the program. And that's really, really important. I've gone through this in a lot of detail, so I won't focus on this slide. But the entry requirements. So what do we look for when you're applying for the program? We need you to have a Bachelor of Science in a medical or health related science degree. So most of our students in the Gulf are doctors, around 70–80%. And most of them are family physicians, but we also get endocrinologists, cardiologists, we get diabetes, or we get nurses, we get secondary care and primary care nurses, we get some pharmacists, but the vast majority are doctors on the program. So we look for your degree transcript, we look for a personal statement of 500 words as to why you want to do the program. We look for an employer or academic reference that you're currently in employment, you are handling or managing diabetes patients on a day-to-day basis, and that you are a person of good repute or good standing. And we need a photo ID. That can't be a nice selfie. It must be an official ID from either your driver's license or your passport, something like that. That's a government official identification. Even though we are, and it's very, very important that I say this, even though that we are an online qualification and you think we can take as many students as possible, that is absolutely not how IHeat works and not how the University of Warwick works. We pride ourselves on one-on-one care and a low level of students so that you get a very nice experience and get to know your classmates very well. As a result of that, and for the fact that we have the face-to-face tutorials, synchronous tutorials, we absolutely have to limit the number of students we take onto the program every year. So just to let you know, places are filling very, very, very fast in the Gulf, and we only have a few places left. So if you do want to apply to the program, I will be sending you an email after this with your recording and your apply now button and your pay deposit button. So if you want to do the program, I urge you not to hesitate. Please go on and apply without delay, just so you won't be disappointed. The fees, this is by far the most important slide in the whole lot, and please excuse me that it's in dirham. The reason I do that is because our headquarters in the Middle East is in UAE dirham. So obviously I'm sure there's plenty of students on from Qatar and Saudi Arabia and Bahrain and Oman, but it's easier for you to make, I suppose, the approximation in your head from euros or from dirham to your own local currency as opposed to converting from euro. I will say also that the dirham is an approximation because we always charge in euro, just to let you know. And so there are currency fluctuations, so the local price can vary, but it will always remain the same in euro. So it's €7,500, approximately 32,500 dirham. And that we have an early bird discount, and that expires at the end of this month. So it expires this day week on the 30th, Friday the 30th of October. And that gives you approximately 3,000 dirham, which is €700 off the program. So you are entitled to get that if you apply and pay your deposit by this day next week. You don't have to have all your application documents in, but you must have your deposit and have begun the application process. So the total fees due with the early bird discount will be €6,800 for the postgraduate diploma. And that's 29,500 approximately in dirham. And that's the deposit is €1,000 to secure your place, which is approximately 4,500 dirham. The MSc, after you can pay the postgraduate diploma in either 2 installments, or if you prefer, we're very flexible, you can pay on a monthly basis, and it'll be the equivalent of €600 per month. And then if you want to progress to the MSc, so the Master of Science stage, that's an additional €4,500. So you don't have to decide that now. You can wait until you're happy and enjoying the program and go, yes, I want to progress to the MSc. And you can decide that then, and it's an additional €4,500 after that. So summary, it's 12 months for the PG dip. It's 22 months for the MSc. The next intake is fast approaching. It's only 5 weeks away. You will get your university certificate from the University of Warwick, which is a top 10 UK university. And nowhere on your certificate does it say distance or online education. You get the exact same qualification as if you went to the university in person. And it is, I don't know if I got the message across today, but it really is enjoyable. Our clinicians and participants on the program thoroughly enjoy it. We have wonderful, anywhere between 16 and 20% of our students come from former students recommending our program. And I think that's just a testament to the satisfaction level of the students. And as I said, hugely important, we have limited places. There are not many remaining now in the Gulf. So if you're interested in applying, I urge you to please apply as soon as possible. And how you do that is I will be sending you an email after this presentation. Well, it'll be within 24 hours with the recording from today and with an apply now button and a pay deposit button. But also, in addition to that, we have our whole education advisor staff here in Dublin, and they will be making a call to you. And you'll see a UK number come up on your phone, and they will be calling you individually to see if you're happy with the webinar, if you have any more questions, and if you want to progress to application. So if you forget to ask us a question today, don't worry, they will be reaching out to you to talk to you in person next week. So be ready for that call when you see a UK +44 number come up on your phone. So that's it. And I will open the floor to chat. And so you're very welcome to ask any questions that you have.
Yeah, so Colin and I have been answering questions as we've gone along. There's been a few, not a massive amount. So if there's questions or clarifications or things that people would like to have explained more, very happy if you put them in chat and we'll answer you.
Sometimes we're inundated with questions and sometimes we're not.
Yeah. I think the point that you made earlier, Rebecca, about the nature of the weekly tutorials being different than this morning's sessions, which is very much one directional, is, I think that's something for people to kind of take away, that the average weekly experience is far more like this conversational back and forth than it would be kind of the presentation that we've given this morning.
Dermot, last night I had an Irish group and they're great talkers, and it went on and on. I'm going to have to be a bit more disciplined. We were sitting there of ages talking about different things and different problems people had, and it was really very interactive and interesting. And we had somebody from Vancouver in Canada, and he chipped in as well. And you know, it was a really very good interactive night. We had nurses and GPs, and they each brought their own individual experience to it. And I must say, it was very enjoyable.
Yeah, and I think that what you've touched on there, Colin, what I love about this program is if you have a mix of the particular group a student is in, and they've got a mixture of some doctors, some nurses, some pharmacists, some dietitians, and they're all from different countries around the Gulf. And when we started doing this, what I found amazing was the different approaches to care in what you might imagine is, you know, a pretty kind of homogenous group. So, you know, the differences between how things are done in Kuwait and how things are done in Qatar or Oman or Dubai, and it leads to fascinating debate. And I think people really do benefit from being in a group of peers where there's different perspectives being brought. For the postgraduate diploma,
last night we have a midwife, and she was telling us about how not to do an oral glucose tolerance test and how much patients don't like it. And it was very interesting because I've stopped doing glucose tolerance tests because they're very unpleasant. And she was reinforcing this. But actually, also we had a GP who's in the heart of Ireland, quite a long way away from a hospital, and he has to do oral glucose tolerance tests. And so we had very interesting discussion on that, I must say. And also pharmacists there who brought a different approach to the situation. So really, it is actually very interesting when you get a multi-professional group.
Yeah.
Rose was
Absolutely.
asking about research in the PG dip.
Yeah, so the research in the PG dip, there is, what you do in the PG dip is you critique the evidence that's out there. So you'll look at the latest research in each of the 6 modules that we've gone through. So in the PG dip, it's very much looking at how you search literature, how you appraise evidence, how you look at kind of the quality of the context of it, everything like that. It's when you get into the master's program that you actually get into doing research. So
yes, although my group this week are going to critically appraise a paper which I've given them to do. Now, the reason why we do this is we've discovered that not everybody's comfortable with critical appraisal, so we've decided to embed this into the week's discussion. It's a well-recognized diabetes paper that we're going to analyze so that people are comfortable with at least the principles of critical appraisal. What we've done up until now is a case vignette, which you've been following. But this week we are doing this critical appraisal. So we don't actually do research. We don't ask you to do research, but we ask you to have your mindset around how people do good research. I think that's a better way of looking at it, Dermot, isn't it?
yeah, absolutely, absolutely.
Rose was asking as well about Qatari Riyals. Just Rose, our education advisors will be reaching out to you all individually and will give you an approximation in your local currency, in every local currency in the Gulf for the program. But I need to reiterate that you will be charged in euro. So the Qatari Riyal equivalency is just what it is today. It may be slightly different when you go to pay the program because we always charge in euro. But our team will be reaching out to you, so you will hear from them in the next few days by phone, and they will give you a total overview of the cost to you in your local currency.
Yeah.
And Sheena was talking about being a nurse. I know we talked a lot about doctors on the program, but Colin just said it there, and we had nurses last night on Colin's group. We pride ourselves on a multidisciplinary education. And it's so much more rewarding and exciting to be upskilled as a team. And so we have pharmacists, we have nurses and doctors on the program, and they seem to work very well together on the program. It's the best way, we think. In terms of the doctor might have three hours a year with their patient living with diabetes, but in terms of RX renewals and contact with the individual, the pharmacist has so much more. So it's so important that they can also recognize maybe mental health issues and just really become part of the interprofessional team in managing this disease correctly in the community.
Yeah.
Humna, you're asking about uncontrolled diabetes. I mean, this is a very dangerous condition. You need to be very careful. We discussed this last night. You need to make sure your patient's not dehydrated, and you need to make sure that they haven't got ketones in their urine. If you're really concerned about uncontrolled diabetes, that often needs a hospital admission. Some people can be very ill, but a lot of times diabetes can be brought under control by the certain measures that we tell you. Simple measures like reducing their sugar sweetened beverages and other things can bring your diabetes under control quickly and your osmotic symptoms, but you do need to take diabetes seriously. We had a pediatric nurse last night, and she was telling us just how ill some of her patients can be when they first present. So we do emphasize the importance of taking diabetes very seriously as a condition.
Okay, not seeing many more questions coming in, Rebecca.
I think that's it, guys. We went 10 minutes over anyway, which isn't too bad, but it's 10 minutes above what we promised to finish at. So we have recorded this. We will send you the email with the apply now and pay deposit button and the recording of today. And if you have any other questions, you're very welcome to reach out to us, but our education advisors will be calling you individually next week. So keep an eye on your phone for a UK number reaching out to you. So thank you for your time today. I know you're all very busy. We really appreciate it. And take care of yourself. Thank you.
Thank you, everyone.
Thanks, everyone.
Bye.